Today, we're going to discuss a very important topic of neurological medicine, that is the dementia. Now, dementia is basically defined as a complete state in which basically there are a lot of variables. A person can have cognitive disabilities, loss of memory, and even a lot of people experience a lack of problem-solving ability that they experience as the disease progresses. Now, the prognostic factors for dementia are not quite good. So again, it's very important that you differentiate dementia from all the other kinds of disorders which are quite treatable and where the prognosis is very good. Just to differentiate dementia from all of these variable conditions, it is very important that you have a complete insight towards this condition. There are motor disabilities that the patients are also experiencing, and that is why it is very important to raise awareness regarding dementia. Dying from dementia and what to expect at the later stages of the disease. Just to have a better patient-doctor relationship, you should have that relationship with the patient and build the confidence and just explain the condition and how it is going to progress in a complete manner and what would be the final clinical picture. It's again very important to maintain a relationship with the relatives, with the friends, and the family as well. Now, what is the condition of the patient when he or she walks into your clinic is again very important because that is going to decide what will be the final outcomes in a particular patient. So the deteriorating conditions and even the underlying causative factors are going to enhance the final outcomes in a particular patient. So you should know that what are the causative factors. There is a range of etiological factors out there ranging from trauma. It can be even genetic and familial in its nature. So taking the history in detail is even more important. Apart from that, when you'd be starting off with the patient particulars, the age, the marital status, the environmental conditions, all of these are also going to affect the final outcome in a particular patient. Then obviously the presenting complaints are very important. And you would be obviously focusing on the overall clinical picture in a patient. For instance, when we were just discussing the case study, we just went through the factors that a 37-year-old just came up to you with problems to perform his daily routine activities that he or she needed to perform. So that is, again, very important. And usually this is the presenting complaint in the patient. The memory loss remains unrecognizable even at a later stage. And when it becomes very troublesome for the patients and the people surrounding him, only then it is recognizable. So there are a lot of charts and investigations that you can carry out for this individual. But before that, you would basically have the complete history regarding the presenting illness. For instance, if the patient comes up to you with the gradual loss to perform the daily activities, even to maintain the proper hygiene of the individual, you would ask whether there was a steep appearance of all of these symptoms or whether there was a gradual onset of the symptoms. Now you would ask, why is that important and what clinical significance does it contain? Basically, a lot of clinical conditions and a lot of etiological factors basically have a steep appearance of all of these symptoms. For instance, Alzheimer's disease, which is basically one of the cause of dementia in the individuals. It is quite treatable. Its prognostic factors are quite good when you start off with the treatment at a very early stage. So diagnosing this condition and identifying this condition at an early stage is very important. Usually, patients who are suffering from Alzheimer's disease would come up to you with features, steep development of the clinical features. And the patients who are suffering from dementia due to some sort of a vascular cause, it can be an infarction, it can be the development of a hemorrhage at a certain region in the brain. Whatever the cause is, there is going to be a gradual onset of symptoms in such patients. So identifying these different etiological factors, they can be even distinguished when you're taking the history in detail. Moving on, you would be focusing on the family history. Obviously, as I already mentioned, genetics play a very important role. So you would be mentioning and documenting everything in detail while you are taking the history. Now, moreover, we have a lot of toxic conditions. For instance, a lot of patients come up to you under the toxic effects of alcohol, heavy metals, and even they would be presenting with a loss of memory. A lot of systemic conditions, for instance, degenerative conditions such as SLE, Alzheimer's disease, diabetes mellitus. Patients usually come up to you with the complaints of loss of memory. We have the collagen vascular diseases, which basically includes SLE, sarcoidosis, and they are, again, a very important cause of dementia or loss of memory in the individuals. Why am I mentioning all of these causative factors? Because you would be keeping all of these factors and ecological factors in your mind while you're taking the history from the patient, and you'd be ruling out whether the patient had some sort of signs and symptoms that are indicating that the patient might be suffering from these conditions. So once you're done with this history, the drug history, past medical or surgical history, the patient might be a diagnosed case of any of these conditions. And ultimately, he or she would be suffering secondarily from the loss of memory. So this is basically all leading towards the definitive diagnosis in this case. Now, the corroborative history from the relatives as well as the friends or anyone who brought the patient to the hospital, the caretakers, it can be an institute, for instance, who is taking care of the patient. So you would be taking the corroborative history from whosoever is available at that point, and you would be asking for whether the condition is deteriorating in a steep manner or whether it is the gradual onset of symptoms in the patient. This is again very important, and it would be basically defining the etiological causes in the individual. Raising awareness regarding dementia is very important because at the end stages of dementia, the person is not even able to move, to speak, and even perform his daily activities, and he is completely sometimes bedridden. All of this condition has to be explained to the caretakers as well so that they are mentally prepared for what are the outcomes of this condition. There are a lot of centers out there who are taking care of these dementia patients, and sometimes it is well needed by the relatives and the friends just to enhance the quality of life for the individual as well. So this is what we'd be discussing over here in this lecture regarding dementia.